Hey everyone, my name is Katie Sheridan. I'm a nurse practitioner student at Auburn University performing a head-to-toe assessment on patient Hunter. In the practical setting, patient would be in a gown, but for the purposes of this video and to maintain modesty, Hunter will remain in his clothes at all times. Also in the practical setting, we would assess everything bilateral, but because of time restraints, we will only do one side. Before entering the room, my hands have been washed, patient's vital signs have been taken, and they're all normal, including height and weight. Patient is alert and oriented ×3. It's his own historian. Has a general well appearance, good hygiene, and his development is appropriate for his gender and his age. So we're going to go ahead and get started with the face and the head. There are no lesions, no infestations on the skin, the face, and the head. The beard has normal distribution. So we're just going to palpate for any tenderness on your head. All right, there's none. We are going to go ahead and palpate the frontal sinuses, the maxillary sinuses with no tenderness, and the temporomandibular joint. Have you open and close? Okay, and he's able to do that with no popping and no crepitus, that is a normal finding. We are going to check the patency of the nostrils. Breathe in. Breathe in. Okay, they're both patent. We're going to notice that the nose is midline with no deviation. Now we're going to assess the mucosa, the turbinates, and the septum of the nose. So I'm just going to look in here. All right, all of that looks good. It is pink and moist, no excessive draining, no bleeding, no swelling, and no perforation of the septum. Now we are going to go ahead and look in the patient's mouth. We're going to look at the buccal mucosa, the roof of the mouth, the base of the mouth, and the gums. All of that is pink, moist, no white patches, and no ulcers. Have you stick your tongue out and say, ah. Okay, so the tongue is pink, moist, midline, and the uvula is also midline, which would all be a normal finding. So now we are going to inspect the eyes. We're going to start by looking at the outer portion of the eye, the eyebrows, the eyelids, the eyelashes. All of that is normal, equal on both sides. I'm going to have you open your eye. The conjunctiva is pink and moist. The lacrimal duct is pink and patent. The sclera is white. The cornea and the lens are normal with no opacities. The pupil is about 3 millimeters on bilateral, and that will be a normal finding, and the iris is also normal. So now we are going to do our ophthalmoscope exam. We're going to be looking at the fundus, the disc, the macules, looking for a red reflex, and checking the vessels of the eye. Okay, so I'm trying to look straight ahead. Okay, the red reflex is present. Everything else looks normal. We were able to visualize the disc, and there is no narrowing of any of the vessels. So we will move on and look at the ear now. We will start by just doing an outer inspection of the auricle, which is normal. No tenderness, no swelling, no redness. We're going to go ahead and look at the ear. Okay, the canal is patent. There's no exudate, no drainage, no foreign bodies, no wax buildup. There, the tympanic membrane is pearly and gray. There's no bulging. The cone of light is visible on the eardrum, and part of the malleus bone is present. Now we're going to move on ahead and do the Weber test. So this is checking for lateralization. I will hit this, and you tell me if you hear it equal in both ears, okay? You hear it equal? Okay. Now we're going to do the Rene test. I will hit this, put it behind your ear. You tell me when you stop hearing it. I'll move it to the front, and you tell me when you stop hearing it.
Okay.
Okay, and that will be a normal finding because air conduction was longer than bone conduction. All right, all good. So now we will move and do your cranial nerves. So I'm going to get you to go ahead and close your eyes for me and just tell me what you smell.
Vanilla.
Okay, good job. You can open your eyes. Now we will move on and do visual acuity for cranial nerve 2 because cranial nerve 1 was intact. So I'm going to hold the Snellen chart about 14 inches from the patient's face. So just cover one eye and read this for me.
DEF POTEC.
Okay, cover the other eye and do it.
DEF POTEC.
Okay, uncover both and do it.
DEF POTEC.
Okay, so patient has 20/20 vision, bilateral. Now we are going to continue on with cranial nerve 2. Just want you to look ahead for me. Okay, pupils are equal and reactive to light. And I want you to follow this to your nose. Okay, and we are going to, I want you to cover up this eye, and I'll cover up this eye, and I just want you to tell me when you see my fingers in your periphery, okay?
Now. Yes. Yes.
Okay, that is a normal finding. Now cranial nerve 2 is intact. So now we will move on and do 3, 4, and 6. This is extraocular movement. So I just want you to follow my pen light without moving your head, just your eyes. Okay, so 3, 5, and 6 are all intact. Now we will, 3, 4, and 6 are all intact. So now we'll move on to cranial nerve number 5. Just want you to clench your jaw. Okay, the temporal muscle and the masseter muscle are both clenched. So that is intact. Okay, I just want you to tell me if you feel sharp or dull, okay?
Sharp. 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 Dull. Dull.
Okay, and now I just want you to tell me where on your face do you feel this cotton?
Forehead. Nose. Chin.
Okay, so cranial nerve 5 is intact. Now we're going to move on and do cranial nerve 7. I just need you to squint your eyes closed, lift your eyebrows up, smile, frown, and puff your cheeks out. Okay, cranial nerve 7 is intact. We'll do 8. We'll test auditory acuity. I'll close one ear and whisper something, and you tell me when I whisper.
3, 4.
Okay, so cranial nerve 8 is intact. Now we'll move on to 9 and 10. We're going to check and make sure that the uvula is midline and that the gag reflex is present and that the uvula moves when we say ah. So say ah.
Ah.
Okay, and now we'll check your gag reflex. Okay, and that is present as well. So now we're going to do cranial nerve 11. So I want you to look forward, back, side, side, and shrug your shoulders. Okay, so cranial nerve 11 is intact, and then we'll do 12. Just stick your tongue out, up, down, and side to side. Okay, and cranial nerve 12 is intact. And cranial nerve 5, 7, 10, and 12 is voice and articulation, and they were also noted and intact. Now we will move on and do the neck. So I'm just going to have you tilt your head back. Just go ahead and look around for any swelling, mass, lesions, scarring. I don't see anything like that on the neck. I'm going to just do some general feeling around for tenderness. I don't feel anything. I'm going to go ahead and palpate the carotid artery. All right. We'll auscultate the carotid for bruise. Okay, there are no bruises present and the pulses are +2 bilateral, which is a normal finding. So now we will move, okay, I'm just going to palpate the lymph nodes now. We'll do the preauricular, the postauricular, occipital, parotid, submandibular, submental, oh, tonsillar, forgot those. Anterior cervical chain, posterior cervical chain, and supraclavicular. All right, and none of those have any swelling or tenderness, and so that will be a normal finding. Now I'm going to palpate the trachea and the thyroid, which all feels good. I'm going to have you swallow. Okay, I don't detect any masses with that. We're going to check your range of motion. I want you to look forward again, back, side to side, and this time twist your neck all the way around. Okay, I'm going to have you lay back in the chair for me just a little bit. And now we are going to, okay, so now we're going to lean back, and I'm going to look away from me. And as the patient is leaning back, the internal and the external jugular vein start to bulge and become visible, and that is a very normal finding. All right, I'm going to sit you back up. you scoot back to the edge of your seat a little bit. And now we are going to move on to the posterior thorax. I will start with, can you turn up, space the table a little bit? Okay. I'm going to just start by palpating for any tenderness, looking at the skin for any lesions or abnormalities. There's no cyanosis, no pallor, no audible sounds of breathing, and no use of accessory muscles. So I don't have any tenderness. I'm going to go here at about the 10th rib. I'll have you breathe in. Okay, no tenderness. We're checking for respiratory tenderness there, and there is none. Now we're going to move on, and we're going to percuss the lungs. We're going to start over here. Okay, and now we're going to percuss for diaphragmatic excursion. So I want you to breathe in and hold it. Okay. And now I want you to exhale and hold it. Okay. And we are going to measure that difference, and it is approximately 3.5 centimeters, which would be a normal finding. Now we're going to test for tactile primitus. Every time I move my hands down your back, I just want you to say 99. Okay, start now. 99.
99. 99. 99. 99.
Okay, sounds good. Now we are going to auscultate the lungs. All right, breathe in for me. Okay, breathe in again. Okay, breathe in for me. Breathe in for me. Breathe in for me. Okay, one more time. Okay, and the last thing we're going to do back here is just check for any CVA tenderness. Your stomach just hurts at all?
No.
Okay, you can go ahead and sit back normal. Now we're going to move on and do the anterior chest. So I would just start by looking at the skin, make sure there's no lesions, no abnormalities, no lumps or anything like that. There are not any. We're going to go ahead and just palpate for any tenderness. Okay, we're going to go ahead and percuss the lungs on the front as well. Okay, all that's good. We are going to go ahead and palpate. Can you switch slide the hoodie off?
Yeah.
Is that possible? We are going to go ahead and palpate at all 5 cardiac points for any thrills or bruits or pulsations. So we're just going to do aortic, pulmonic, Erb's point, tricuspid, and apical pulse. And I'm going to go ahead and palpate the apical pulse, and I don't feel any pulsations or anything like that. Now I'm going to have you say 99 again as I move my hands down.
99. 99. 99.
Okay, all that's good. Now we're going to auscultate the lung sounds on the anterior chest as well. Okay, breathe in. Breathe in. Breathe in. Breathe in. Okay, all that's good. Now we will assess the cardiac sounds at all 5 cardiac points with the diaphragm and the belt and stethoscope. All right, and I'm going to have you just lay back, and we're going to do all of that one more time while you're laying down. Okay, we're going to listen to all the heart sounds at all 5 cardiac points with the diaphragm and the belt and stethoscope. all of that is normal. There is no bruise, no only S1 and S2 heart sounds and no murmurs. So I'm going to go ahead and check your radial pulse. Okay, your brachial pulse. Okay, we've already done your carotid and we're going to do your femoral, but we are not going to do that in this video for the purpose of modesty. Now we are going to move on and look at the abdomen. We would just look at the skin, all of it's normal, the curvature is normal, there is no peristalsis, no pulsations. We are going to auscultate in all 4 quadrants. Alright, bowel sounds are active and present times 4, and now we are going to listen for any thrills or bruise at the aorta, the iliac artery, the renal artery, and the inguinal artery, and we would do the femoral artery, but we are not going to right now. Alright, and there are no bruise noted. Now we will percuss the abdomen in all 4 quadrants. Alright, all of that is normal. We are going to go ahead and percuss the liver. Okay. We will measure that. And that is about 7 centimeters, which is a normal finding. Okay. We are also going to assess the abdominal reflex. All right, and that is present. Now we will move on and do your extremities.
Okay.
While you sit up for just a second, I'll do your arms. All right. We're going to start by just noticing that the muscle mass is normal. There are no skins and lesions, no skin lesions or anything like that. We are going to grab both my hands. Grips are equal bilateral. Pull against me, kind of, sort of. Okay, now push against me. Muscle strength is 5 out of 5, which is a normal finding. We are going to assess the epitrochlear nodes. None are swollen, none are tender. We're going to go ahead and assess the shoulder joint. And do the range of motion of your shoulder. So just do what I do. Up, back, behind your head like this, behind your back like this, and across your chest like this. Okay, so that is good. We're going to go ahead and do your elbow. Okay, all that is normal. I'm just going to have you do your arm out like this. Do it like this, and bend it up. Okay, and that's good. Now we're going to move on down and just do the wrist and the hand. Wrist joint feels good. Hand feels good. Try to open your fingers up. Okay. And now we're going to have you just do your range of motion of your wrist, side to side, up and down, into your fingers. All right. I'm going to have you close your eyes. And I just want you to tell me what is in your hand.
Paperclip. Okay.
And that's stereognosis, which is good and normal. Now we're going to just do your coordination, so I just want you to do what I'm doing. Okay? I'm going to hold my finger out. I want you to touch your nose and then touch my finger. Okay? Do it one more time. Okay? So coordination is good and coordination is intact. Oh, and we're going to make sure that your capillary refill is good. Look right here. Okay? And it is less than 2 seconds. So now we're just going to lay you back one last time and look at your hips and your knees. Okay, let me see. The lower extremity looks good. Muscle mass is normal. No abnormal venous patterns are noted. This hip looks good. Feels good. I'm just going to have you do your hip out. Extend your hip out. Cross it over your other leg. Okay. And can you lift it just straight up like this? Okay. All that's normal. And now we'll go on and do your knee. Okay. All that feels good and normal. And we'll just have you bring that up to your chest. Okay. Now I'm going to sit you back up. Now we're going to move down to the foot and the ankle. We are just going to make sure that there's no swelling, no pain. On palpation, capillary refill is +2. Have you just move your ankle around, foot up and down, and side to side. All right. So that's intact. I'm going to go ahead and feel these pulses down here. The dorsalis pedis, the distal tibialis, and the popliteal. All right, all those are present. We're going to go ahead and check for sensation on your foot. I just want you to tell me where I'm touching on your foot.
Side, the top, the toe.
Okay, so all of that is intact and normal. Now we're going to move on and check all of the reflexes at once. Oh, let's check your muscle strength. Okay, pull against me. Okay, and now push against me. Okay, now we're going to just go ahead and check all of your reflexes at once. Just hold your arm lightly in your lap and just try to relax. This is your radiobrachialis. Okay? Now I'm just going to have you keep relaxing like that, and we're going to do your bicep. Okay? Now we're going to do your tricep. Just hold it up and relax. Okay, I'm going to scoot back in the chair so your feet will dangle a little. We're going to check your patellar. Okay, going to check your Achilles. And you're going to do your Babinski. Okay, everything on that was normal. The toes did not flare on the Babinski, so that means that we are normal. Now I am going to have you stand up and turn and face that way and bend over. We're going to assess your spine for scoliosis. There's no curvature of the spine. All right, you're already bending over. We're going to have you just bend back, kind of like a back bend a little bit, side to side, and twist. Okay, now you can turn and face me. Hold your arms out by your side and close your eyes. Okay, there's no drifting, so that's a good Romberg test. Okay, now I'm just going to have you walk a little bit across the room, normal, just like a normal, to assess your gait, which is normal. Come heel to toe for a couple steps back this way. Okay, and then on your tiptoes. And walk a little further. Okay, all of that is good. All of your musculoskeletal system is intact. All right, that is it. We will be done. Thank you so much.